Hi, this is Scotty, and welcome to week 9. I thought this week I would talk about something that I'll call cross disciplinary knowledge. We've talked a little bit about working in integrated care settings, and I think, uh, hope I'm not mistaken, believe Carolyn has introduced us a great deal to that. And I believe that the environment that I'm working in could probably be called an integrated care environment. I'm working in an outpatient mental health office that is located within a primary medical care clinic. So we have an MD there, just a general practitioner, and a couple of nurse practitioners who provide medical care to dozens of patients on a daily basis, and the sources of our referrals are sometimes this physician and nurse practitioners. Sometimes the referrals come from other clinics, medical clinics, schools, hospitals. So we get referrals from everywhere, but the fact is we are located in a primary care clinic, which begs the question to me, how much do we need to know about disciplines such as healthcare and medicine, those type of things. Um, I come from a background in medical care. I basically provide social services in a medical facility, so it has helped me a lot over the years to learn about various medical conditions that may impact mental health. And talking about, I have a patient, lots of patients with dementia, and dementia often presents with psychiatric symptoms such as paranoia, hallucinations, various other types of delusions. Um, we have some young people with multiple sclerosis, and I've learned a lot about a genetic disorder called Moya, which is neurological. Also learned something about a disorder called Farr's disease, both of which are neurological diseases that naturally result in behavioral symptoms or behavioral problems. So, what this is basically caused me to do in an outpatient therapy setting is every time a patient comes in with different complaints, my first thought is, have they had a CT scan, or have they had lab work? What's their thyroid function? Is their ammonia level high? Excuse me. I've worked with clinical social workers in the past who love to have a resident's lab values, and I'm talking about not just lithium levels or depakote levels, but what's their kidney function, what's their liver enzymes look like, what's their thyroid function. There's so many medical issues that can affect psychiatric presentation. So this also has led me a lot to look at medications. There are lots of medications for medical disorders that can cause psychiatric symptoms. There used to be a lot of old drugs that were used to treat high blood pressure that one of the main side effects was depression. So when we talk about doing a biopsychosocial assessment, um, how much focus do we need to place on the bio part of it? Um, you know, Working with a lot of people with neurological problems has kind of maybe skewed me to want to look at that first of all. I was always taught that we rule out the medical before we go to the psychological, but it seems to me that that's not always the case. We get a lot of people coming in. well, we've had people come in on EAP programs who come from settings other than healthcare who've not seen a doctor in years. And, what's our first step? Do we need to get a full physical and lab work and blood work and everything on these folks? So I guess my question to you this week is, how far do you think we need to go in learning about those other disciplines who treat issues that may have a psychiatric component to it? So I guess that's it. Look forward to your responses. Thanks.